The title of my video is Causes of Frequent Urination, also known as urination frequency, ranging from benign to more serious health conditions. We all have those moments, right? Rushing to the bathroom, wondering why we have to pee again. Well, today we're diving deep into the why behind frequent urination. So grab your water bottle, because ironically, we're about to talk about peeing a lot. And let's get informed. First up, one reason is some drinks can make you urinate more frequently. Let's talk about the everyday stuff that can send us on a bathroom sprint. Think about it. That giant iced coffee you love? Yeah, caffeine is a diuretic, meaning it makes you pee more. And that glass of wine with dinner? Yep, alcohol is guilty too. Even some medications, like those prescribed for high blood pressure, can have you running to the loo more often. But hey, I'm not saying ditch your morning coffee or Friday night relaxation just yet. It's all about balance, right? Being mindful of what you're consuming and when can make a world of difference. For example, try not to chug water right before bed. Give yourself a little time cushion before hitting the hay, and you might just get a more restful night's sleep.
Check one, check two, check.
Another cause are bladder problems. Okay, our bladders, those amazing holding tanks, can sometimes have their own issues. Ever had a UTI or urinary tract infection? Ugh, the worst, right? That burning sensation and constant urge to pee is your body's way of fighting off infection. Then there's overactive bladder, or OAB. Imagine your bladder's like that friend who always jumps the gun. It just contracts randomly, making you feel like you gotta go right now. And for some, there's interstitial cystitis, a chronic condition that can cause pain and frequent urination. The good news? There are treatments for all of these. So if you suspect your bladder's acting up, please talk to your doctor. Another reason for frequent urination are hormones and high blood sugar. Alright, now let's talk about hormones, specifically when things get out of whack with diabetes. High blood sugar, a hallmark of diabetes, can actually lead to increased urination. Think of it like this. Your body's trying to flush out the excess sugar through your pee. And then there's diabetes insipidus, which is much rarer, but still important to mention. This condition messes with the hormones that regulate your body's water balance, leading to, you guessed it, a whole lot of pee. The takeaway here? Hormones are powerful, and when they're off, our bathroom habits can definitely be affected. Another cause of frequent urination for guys or men are prostate problems. Okay, fellas, this one's for you. As we get older, our prostates, that little gland near the bladder, can start to grow. Sometimes it's no big deal, but other times this benign prostatic hyperplasia, or BPH, can squeeze on your urethra, making you feel like you have to pee all the time, even if you just went. And then there's prostatitis, which is inflammation of the prostate. Not fun at all, and yes, it can also lead to those gotta go now urges. So guys, if you're experiencing any changes down there, don't brush it off. Talk to your doctor, get things checked out. Another cause is pregnancy. Ladies, let's be real, pregnancy is incredible, but it can do a number on your bladder. That tiny human growing inside of you? Yeah, they need space, and unfortunately, your bladder takes the brunt of it. As your uterus expands, it puts pressure on your bladder, making you feel like you constantly have to pee, even when you just went a few minutes ago. It's totally normal, and honestly, kind of a rite of passage for expecting moms. But hey, at least you're well hydrated, right? Another cause is when nerves misfire and effects in neurological. Now let's get into some more complex scenarios. Our brains and bladders have this intricate communication system going on, but sometimes things like a stroke or spinal cord injury can disrupt these signals, leading to changes in bladder control, including, you guessed it, frequent urination. Another cause is multiple sclerosis, or MS, can also interfere with the nerves that control your bladder. It's a reminder that our nervous system plays a huge role in, well, pretty much everything. Another causes or culprits for frequent urination are stress, kidney stones, and weak pelvic floors. Last but not least, let's talk about a few more things that can contribute to frequent urination. Ever notice how you have to pee more when you're stressed or anxious? Yeah, our minds and bodies are super connected, and anxiety can definitely manifest physically. Another cause is there are kidney stones, those pesky little crystals that can cause excruciating pain and, you guessed it, frequent urination. And finally, we have pelvic floor dysfunction, where the muscles that support your bladder and other pelvic organs are weak, leading to, you got it, more bathroom breaks. Listen to your body. Your health matters. So there you have it, the whys behind frequent urination. Remember, our bodies are constantly communicating with us. If you're noticing changes in your bathroom habits, don't ignore them. If frequent urination is persistent, disrupts daily life, or is accompanied by other symptoms like pain, blood in urine, or fever, consult a healthcare provider for evaluation and appropriate treatment. Knowledge is power, and when it comes to our health, being informed is key. Take care of yourselves, everyone.